Excellencies, Cik Yana Karim, Dr. Ken, ladies and gentlemen. I'm very honored to be part of this panel and of course in celebrating this day, International Day of Eradication of Poverty. Poverty is indeed complex and multifaceted. In many participatory studies on poverty, when the poor is asked to describe their life, we hear that it is not just the lack of money. In fact, they rarely talk only about money. They will talk about their children not doing well in school, about the flooding that happens often where they live, the difficulty of getting internet access for working or learning from home. These are the things that keep them awake at night. So the problem of the poor is much more integrated. And if a household suffers from many types of these structural burdens, we can say that the household is multidimensionally poor. So this is the idea of multidimensional poverty. And unfortunately, concept of multidimensional poverty is not a sum of 1 + 1 becomes 2. Often the problem reinforces each other. For instance, lack of security or violence affects educational outcomes. Lack of transport is not just lack of transport. And like Cik Yana mentioned just now, it affects the ability of gaining income or safety when going to schools, for instance. Mental health issues arising from dysfunctional family institutions, limited knowledge on sexual and reproductive health, ineffective parenting skills, lack of work-life balance, over-indebtedness, as well as excessive internet addiction. We are acutely aware that these problems will affect health and education outcomes of the poor. So these issues are important to them and therefore should be important to us when we want to design policies to eradicate poverty. Ideally, money resources are there to create the capabilities for these households to come out of poverty and to prosper beyond that threshold of poverty and to prosper further. And this is the idea behind the human development approach, which UN adopts. It guides the UN, which UN adopts and guides our interpretation and actions in eradicating poverty. So we measure development by how empowered an individual is, not just the amount of money that they receive, but how empowered they are, how capable they are to realize the lives that they desire through the acquisition of things and non-tangible things, or capabilities. The idea of providing people with capabilities so that they can live the life that they want to live, to be who they want to be. So the concept of multidimensional poverty based on that, it goes beyond income. Let's take an example. If a family is given 100 ringgit, just to ensure that the child in the family is able to go to school. Yeah, so it covers the bus fare and it can cover some basic stationaries. So that's the you can call it basic needs or whatever income, but the receipt of that 100 does not guarantee that the student will develop the capabilities that is meant for him by going to school. There could be other problems that hamper his capabilities to do well in school. And by doing well in school, perhaps he will have later in his life more choices, more work choices, more options to live the life that he wants. So there could be problems such as violence in school, discrimination, lack of the right infrastructure, for instance, for PWD students, mental stress, all of this that could cause the child to not be able to learn efficiently and in worst cases, drop out of school altogether. So resolving income poverty is not the same as resolving multidimensional poverty. They are different, but they must happen together. They must go hand in hand. Ladies and gentlemen, last week, on the 7th of October, UNDP and OP launched the new figures for the Global Multidimensional Poverty Index, or what we all know as the MPI. Across the 5.9 billion people who live in the 109 countries studied in the report, more than 1 in 5, about 1.3 billion, are considered multidimensionally poor. And half of this number are children. But country-to-country differences are equally interesting. If we go to, for example, we take Pakistan. Pakistan has about 38.3% people who are considered multidimensionally poor, but only 4.4% are considered income poor. So you see the difference between income poor and taking into account other deprivations or lack of capabilities into account. Yeah? While in South Africa, 18.7% are considered income poor, live under the poverty line index or poverty line income, but only 6.3% are found to be multidimensional poor. That means despite of having low income, they are suffering less in terms of being health poor or educational poor. So it's different. So that means that both income and multidimensional measure stress again, that must be interpreted together. We must understand the who, where, and how of the people who are poor. So the Multidimensional Poverty Index uses a number of indicators to measure determinants of well-being. But the conditions to develop the well-being themselves are actually good health, education, decent standard of living, and some countries have now added gender equality, income security, and not just income level, but income security, stability of income, access to digital services, tertiary education, and so on and so forth. The Malaysian MPI, for instance, has 4 poverty dimensions: health, education, standard of living, and income. And the recent 2019 HISBA findings showed that 1.1% of households are considered multidimensional poor, as compared to 1.5 in 2016. So this is the aggregate number. If we drill down by dimensions, we find that the highest incidence of deprivation is seen in quality or standard of life, which takes the form, or the indicators, the proxies that were used were like garbage collection facility, 13.3% are deprived of good services in terms of garbage collection, and this affects their life, right? Their capability to function and work. Followed by room crowdedness, again, affects their capability to work and function. Access to healthcare facilities, 6.5%. Income poverty, 5.6%. But beyond the MPI, there are also other data that can be found related to multidimensional poverty. For instance, prevalence of underweight among children under 5 years of age is 14% in 2019. Stunting is 21.8%. Wasting is 9.7%. And all of these numbers is higher than the 2016 numbers. Suicide cases are on the rise, distress call for emotional, mental health, they're all on the rise. We all know the stories, it's on the newspapers all the time. But we also still have problems of treated pipewater in certain states, electricity and so on. And COVID has just made everything worse, and we were caught by surprise, but the poor were caught by even more surprise, because they did not have any backup system for such a calamity. So if we understand that poverty is for most part driven by the lack of ability to create that opportunity, or to reduce disadvantages, the multidimensional poverty, then the solution must also lie in creating and expanding opportunities by reducing discrimination, by reducing anything that could hamper a person's ability to prosper and to create the wealth or the well-being that he wants to create for his family. So it can be by introducing innovations, creating the right partnerships amongst the poor, between the poor and the community, between the poor and the government, services, creating social arrangements that could help women, for instance, to go out to work, PWDs to enter the labor market more effectively, opening up space and opportunities to digital community, financial literacy. So these are all methods or pathways to develop strength, the economic strength, the empowerment, social empowerment strength, and in order for the household to break away from the thresholds of poverty. I think.
Thank you, Dr. Haniza.